A big step to help combat a healthcare crisis across our communities. This after the COVID-19 pandemic took lives, forced individuals and families into isolation, and created some long-lasting side effects in our communities. Q2's Janelle Slade has more tonight on a pilot project that has now landed in 3 Montana counties.
It's what's being called a sustainable mental health model. All the remnants from COVID combined have also brought out and brought attention to more behavioral health issues. But a recent $4 million grant and some dedicated community entities are working to reverse that COVID trend.
So many entities said in the very early stages, you will see a tsunami of mental health and addiction treatment, and we are seeing that.
Lynette Kosovich, CEO at Rimrock Foundation, says her team saw a 40% increase in mental health and substance use referrals in the last year, and calls to Montana's suicide hotline doubled. But now a $4 million federal grant is helping Rimrock implement a certified community behavioral health clinic, or CCBHC.
It is a model of care where you have to address every single aspect of a person's life. Physical health, their addiction, their mental health, their housing, their transportation, their relationships, everything that could negatively affect their well-being.
This model is designed to create access, stabilize people in crisis, and provide treatment for those with the most serious mental illnesses and addictions.
It stops the episodic treatment of substance abuse or mental illness, and we look at you as an entire person. What is causing these things? And by the way, we're going to also offer some really effective treatment for you to get you to a place where you want to be.
Kosovich recently testified before the Senate Finance Healthcare Subcommittee.
We need to finally treat healthcare above the neck the same way we treat healthcare below the neck.
Senator Steve Daines is the ranking Republican on that committee.
Since the pandemic, lockdowns, economic hardships, social isolation have only helped intensify what we already know, and that is we need mental health services in our communities, and we need to make this a priority.
Data shows in January, 41% of American adults reported they were struggling with anxiety and depression. That's up from 11% before the pandemic. And Montana is certainly not immune. Daines points to data showing Montana is 4th in the nation for suicides. And that's not all.
Montana ranks #1 of children in foster care. 65% of those children that are removed from foster care have parental use issues, meaning their parents are using illegal drugs. How is that acceptable? How can we keep doing that?
The plan behind these clinics digs roots deep in the community by coordinating with schools, crisis centers, and law enforcement. And the clinics must guarantee specific services, like a 24/7 mobile crisis team and a primary care provider for each patient.
You know, historically, we have always separated mental health care and physical medical care into 2 separate buckets. But the reality is we're integrated people, and those issues are often integrated together. If your mental health is not being tended to, then oftentimes your physical issues and your chronic diseases are worse for the wear as well.
Dr. Megan Littlefield says this type of model works. Riverstone Health has combined mental health care along with primary care in its facility for 15 years and now plans to partner with Rimrock.
I think the more that we can collaborate across organizations and try and integrate those services together in our community, the better off our community is as a whole.
The latest impact report shows thousands of new clients are being served in these clinics, and nearly all of them are getting treatment within a week. That's compared to the average national wait time of 48 days.
So overall, people are moving on a trajectory of wellness for maybe the first time ever.
Kosovich says while the numbers show the success, the one thing that is hard to measure, even in Montana, is the cost of not moving forward.
We can't do it alone. You know, you've heard the saying, it takes a village. This is going to take our state to do this, because once we all get into the CCBHC model and we're all rowing in that same direction, I think we're going to make a huge difference.
The first participant will take part in the full Rimrock Clinic by June 1st. There are also pilot programs currently underway in Missoula and Cascade County. In Billings, Janelle Slade, MTN News.
Thanks, Janelle. A nonpartisan effort in the U.S. Senate is expected to introduce legislation this month, giving every state in the country the option to take part in the program.